Hello all, welcome to Pragmatic. Today I am going to demonstrate the clinic management module in Odoo. So this is the overall view of the clinic management. Like they have so many functionalities are there like appointments, patient, inpatient, prescription, laboratory, imaging, pediatrics and canteen management, surgery, ambulatory service, blood bank management, all are there. And first of all, I am going to the configuration part. Here you can see these all are the configuration part like diseases. So diseases there are 10,000 plus diseases are inbuilt diseases. When installing this module, that time automatically is came. Then we can to add the pathology groups, disease categories. There are something inbuilt disease categories also there, and lab test units, lab tests also there, and imaging test type, imaging test, and the health centers. We can to create the health centers, health center building units, wards, beds, operating rooms. These are we can to create manually, and also the operational areas we can to create, and the operational sectors also we can to create, and also this physician. So we can to create physician like this, add the physician name, and the specialty is select, and the slot we can to set that particular doctor, weekday, and starting hour and ending hour we can set that, we can set that particular weekday. And next they have a medicines are there, so there are something 375 inbuilt medicines are there. And also we can, there are dose units and administrating rules, and the medicine categories also there. And also we can to create the insurance company and insurances and insurance plans we can to create. And also the medical specialties and occupation ethic groups, recreational drugs and genetic drugs, these all are inbuilt for that particular module. And these all are the configuration part. And next I'm going to the patient. So this is the patient master, so we can to create patients to here like adding the patient name, and we can to enter the gender, we can to select the gender, and we can to select the date of birth here, that particular date of birth, the age will be automatically came. And also they have any critical information we can to add here, and also the general all information are to add to here, the blood type and the marital status all are to add to here. And next is diseases tab. So if you have any diseases for that particular patient, we can to select to add here, and there is any meditation we can to add here. And all created appointments are showing to that particular patient, showing to here. And the genetic risk we can to add, that particular patient have any genetic risk we can to add here. And the lab test, so they have any lab test created for that particular patient, all lab sets are showing to here also. And we can to set the lifestyle like the physical exercise and diet info all are set to here. And any surgery is created for that particular patient, so that also we can to show into here. So any socio-economics, so we can to add here also. So this is the complete patient medical history for that every patient. Okay, and next I'm going to that particular appointment. So this is the appointments form. We can to create appointments like adding patients, and the urgency level we can to set, and the start time and end time we can to select here. And also the duration also we can to select here like hours and minutes. And we can to select the health center, and the patient status we can to select here, and specialty we can to select here. And also physician and consultation service also we can to select here. And this is the information tab. We can do any information for that particular appointment we can do enter in here. And if there are any pediatrics symptom checklist, so that created checklist will be showing to here. And any prescription created, so all prescriptions are showing to here. This particular appointment, if you have any prescription created, so that prescription will be showing to here. And next is vital signs. So the vital signs is nothing but like we can to add the BMI result and cholesterol, blood pressure, diabetes, we can to add to here also. And next I'm going to the inpatient. So this is the inpatient for that particular patient, admitting for that particular patient. So here we can select the bed and the hospitalization date and attending physician, admission type we can to select here. And also select the patient and expected discharge date we can to select here, and the operating physician we can to select here. And here this is the bed transfer history. That is nothing but we can to uh, transfer this bed. So first of all I am selected the bed 1, so then I am transferred to bed 1 to bed 3, so that history will be showing to here from first of all the bed 1 and change it to bed 3. So the any reasons we can to add here, and here we can to create invoices also, and we can to add nutrition, we can to add here, and meditation. For that particular inpatient we can to add any care plan for nursing plan, discharge plans we can to add here also. And this is the ICU, so that particular inpatient admitted patient we can to any ICU ICU have there, so that will be showing to here also. So the inpatient they have a ICU patient ICU info, so this is that particular patient ICU info. So we can to select that particular inpatient code ID, and they have a button like admit. So when admit that time, the admitted ICU admitted date and time will be showing, and discharged when discharged that time, that discharged date time will be showing to here. And we this is a duration uh, period like ICU admission to discharge, so that time will be showing to here also. And also they have a ventilator history, so we can to add ventilator history also to here directly. And next is laboratory, so we can to create the test directly to here. And first of all the selecting the doctor and the test type and patient name we can to select here and save. That time the uh, particular test will be created, and they have two buttons are there, one is create invoice and another one is create lab test. So we can to create lab test, that time the result will be created, the result will be showing to directly in lab test results. So here you can see that particular result will be created, so we can to add the uh, results directly to here, the lower limit and upper limit, that particular results will be showing to here. We can to create that particular result also. And next is we can to create multiple tests, we can to directly create here for one patient have that multiple tests, so that time the multiple test wizard utilize, so we can to add multiple tests to directly to here also. And next is imaging, so imaging nothing but this is x-ray, so we can to take the x-rays also here, so that is selected test, and the physician we can to select, and also the patient also we can to select here, and the urgent or not we can to select and confirm, then invoice, then only create test will be created. So invoice also created, when click the create result, so the result will be created, that result will be showing to image test result. Here we can to see all test result, and they have upload that particular x-ray result image we can to upload here also. And next is pediatric, so newborn baby, so we can to enter for the newborn details for that particular patient, so the mother name and the baby name and the gender also we can to select, any finding and testing we can to select to here, and any checking details also we can to select here, and also is have any diseases or other that particular baby, so that also we can to select any medicine, so we can to select here also, any testers we can to select uh, here also. This is the newborn information. And next is pediatric checklist, so this is nothing but we can to select the patient name, and they have some types of questions are there, so if you have any systems type questions, so they have three types of answer like never, sometimes, often. So we can to select all questions are like the answers. If we have any symptom checklist we can to create here also. And next is canteen management, so here is the canteen management. So this is candy management form view. So we can to create the canteen food details from the canteen management. So adding the patient name, and if we have any parcel fee, we can to enter here, and date we can to enter here. And next is we can to add the food items, and we can to also create invoice button and the payment button also here to showing. After paid, that time the token number will be generated, the delivery will be recorded in the inventory, the delivery transfer also we can to done, and invoice will be created to here. and they have some prints are there like canteen order report and canteen token, so we can do directly to print here also. And next is surgery. So this is the surgery, so we can to create surgery for that particular patient, adding the reason of the operation and surgery clarification and the anesthetist and surgeon signed by, we can to select that particular this, and date of the surgery we can to select, and end of the surgery we can to select, and that time period will be the duration will be automatically showing to here that particular time. So the surgery duration will be taking to this field, and also we can to add the operating room also we can to select, and surgical safety checklist we can to add here also. So any detailed information code or anesthesia report, so we can to add here also. And next is invoices. So this menu will be showing to like the lab test request to be invoiced, and today lab test request to be invoiced, and appoint to be invoiced. This is nothing but when lab test is created, the invoice is not created, so that types of record will be showing to here also. These also not created the invoices. So when I go into that particular today's lab based record, so they have not created invoices, so that details will be showing to here. So I'm going to the appointments. So there are two appointments are there not created the invoices, and next I'm going to that particular prescriptions, so that also not invoices are created. And next is ambulatory services. So this is the ambulatory service, so we can to create the ambulance type and model, we can to create that, and also ambulance also we can create, and we can create driver also, and that particular driver we can to assign that particular ambulance also. And after that the ambulatory service working like, so this is the ambulatory services. So there have some stages are there: draft, submitted, in progress, assigned, picked, and admitted. So when the service will be created, so the patient name and the condition and all are to select and submit, and that submitted time the coordinator are there, so that coordinator will be assigned the driver. So the driver information details will be showing to here, and the driver will be picked, and the and at last admitter also that time admitted, the state will be changed to admitted. That time the patient will be saved into that particular patient master. So here you can see that particular patient will be admitted also here the patient master. And next is the blood bank management system. So here the blood bank management system, this is nothing but we can to create the blood donors. So I'm on created the blood donor like Arpit, so his blood group is A positive, and the general information also we can to add. And next is the donation. So here we can to see the blood donation, so we can to create the blood donation, entering the details for that particular. When selecting the donor that time, when selecting the donor that time the blood group and all details will be showing. So select the blood bank and how many units to donate, so I just adding to 2 units. And storage also we can to select, and donation date also we can to select. And next is save this, so the donation record will be saved. And next is going to test that blood. If blood have any confusion, so we can to add the report also. So I am just adding to normal, so no confusions are there, then save. Then they have option to the report is wrong, so that particular record will be we can to reject. The blood is normal, so no complications, so we can to donate. That time that particular donor donate that two quantities of blood, so that blood stock will be showing to the blood stock. So here you can to see the there are six quantities are there, so two quantities is updated, so six quantities are showing to here. And I'm going to create a new blood request. So here we can to see that particular blood request blood we can to select an approximate required date we can to select here, and patient also we can to select, and patient category is outpatient or inpatient we can to select here. And also it's urgent or not, if you urgent, so select the urgent button and select the blood bank and the unit, so we can to select here. So I am just adding to 3 units, and next is storage also we can select, then save, then request, then process, then receive button click. So when I receive button clicks, the blood stocks have no such a amount of quantity of the expected quantity is 3, so only 2 quantities are there. Just that time the partially received operation status also here. And so currently I'm going to receive that time that particular blood bank blood is received. Here we can to see the transfer history for that particular blood. So I'm going to the blood store. That time the blood of 3R quantity is reduced. So this is that blood bank management system. And next is reporting. So this is the particular evaluation of appointment evaluation of per doctor, per health service, per this prescription and specialties. When clicked that here to the physician, we can to select and start date and end date. So that particular period, the created invoices are showing to here like here. So this is the reporting. So all are like to showing like this. So next time I'm going to that particular website appointment. So they have online appointment also there. So this is the online appointments. So when I appointment click, so they have two option: create appointment and existing appointment. So we can to click that existing appointment. So already created appointments patient email we can to select and submit. That time that created appointment will be showing to here. Here we can to see there have a reschedule button and cancel button also there. So we can to click to reschedule. That time the appointment we can to reschedule. If cancel, that time the appointment will be cancelled. So next is I'm going to create a new appointment. So that time the current day available doctors are showing to here. So that doctor will be click that the available slot are showing to here. When click that particular slot, here no patient and existing patient. If patient already have there, so you can to click to existing patient. There are no patients, so click new patient. That time the patient will be added, and email also we can to add, and also the consultation service also add and submit appointment. So the appointment is created successfully. This record will be recorded into the backend also. Then I'm going to clinic appointments. So here you can see that appointment will be created to. So next I'm going to at last the dashboard. Here all details are showing to here. This is a time parameter, so we can to select that the last 65 365 days all details are showing to here. The counts, appointments, admitted patient, emergency cases, free beds, number of ICU and blood requests, blood stocks are showing to here like here. And surgeries, lab test requests, canteen orders, ambulatory requests, and the total revenue also showing. And the fee also here, the lab test and appointments, and the doctor revenue and the ambulatory services, and also the BMI results also showing to here. And the average test details are showing to here. So this is the overall view of the clinic management system. Thank you.